Most CRNA students describe their program as the hardest thing they've ever done. Harder than nursing school, harder than their ICU job, harder than they ever imagined. And they're not exaggerating. I'm about to walk you through exactly what a day in the life of a CRNA student actually looks like during didactic and clinical, so you know exactly what you're signing up for. Spoiler alert, it's brutal. But thousands of people make it through every year, and so can you. Let's get into it. Let's start with the didactic phase. That's the front-loaded classroom portion that lasts 6 to 12 months depending on your program. 6 a.m. Alarm goes off. You review today's lecture topics over coffee because you learned quickly that going into class cold is a recipe for being completely lost within 15 minutes. 7:30. Arrive on campus. You're reviewing flashcards with classmates. Everyone looks tired. Someone brought donuts, a small mercy. 8 a.m. to noon, lectures. Today, it's pharmacology covering opioids and analgesics. Then anatomy doing a deep dive on airway structures. Your professor just covered what would have been 2 weeks of undergrad material in 90 minutes. You're recording everything because there's no way you caught it all. Noon, lunch break. You eat quickly while reviewing notes. A few classmates organize a study group for Thursday's pharm exam. 1 to 4 p.m., more lectures. Pathophysiology of cardiac disease. Principles of anesthesia covering induction techniques. By 3 p.m., your brain feels physically full. They call it drinking from a fire hose, and now you understand why. 4:30, head home. You think about going to the gym, but you know you have hours of studying ahead. 5 p.m. to 10:30, study time. You're rewatching today's lectures at 1.5x speed while eating dinner. Making flashcards, reading tomorrow's assigned chapters, 75 pages. Working on a case study presentation. 10:30, finally stop. Your eyes hurt. You feel like you retained maybe 60% of what you studied. Tomorrow you do it all again. Your total weekly commitment during didactic? 70 to 90 hours. And that's not an exaggeration. So what are you actually learning during all those hours? The didactic phase covers an enormous amount of material. Pharmacology. You need to know mechanisms, dosing, and drug interactions for every anesthetic agent, vasoactive drug, and emergency medication. Anatomy and physiology. In-depth review of every body system with focus on anesthetic implications. Pathophysiology. Disease processes and how they affect your anesthetic management. Chemistry and physics. Gas laws, vaporizers, equipment function, monitoring principles. It's way more science than most people expect. And the exams? They're constant. 1 to 2 major exams per week. Quizzes between major exams. Practical skills assessments. Case study presentations. Written assignments. Someone described it as perpetual exam mode. You're either taking an exam, recovering from an exam, or studying for the next exam. Then, there's simulation lab. You practice on mannequins before touching real patients. Intubation, over and over until you can do it smoothly every time. IV placement, arterial lines, crisis scenarios like malignant hyperthermia and cardiac arrest. These sessions are high pressure. Faculty evaluate your technical skills, decision-making, and communication. You might spend 4 hours in sim lab and leave feeling like you just did a full clinical shift. Now, let's talk about the transition to clinical, because this is a whole different kind of intensity. 4:45 a.m., alarm goes off. First clinical day, you barely slept. 5:30, arrive at the hospital. Meet your preceptor, a staff CRNA. They seem nice, but you're terrified. 5:45, pre-op. Your first case is a 62-year-old male for knee replacement. You reviewed the anesthetic plan last night, but suddenly everything you studied feels inaccessible in your brain. 6:45, or room setup. Your preceptor watches as you prepare. Check anesthesia machine. Draw up drugs. Your hands are shaking. Prepare airway equipment. Set up monitoring. You triple-check everything. Your preceptor gently corrects a few things. 7 a.m. Patient in the OR. Timeout complete. 7:10. Induction. You place monitors, start IV medications under supervision, pre-oxygenate the patient. 7:20. Intubation. Your preceptor lets you try. Your hands shake as you hold the laryngoscope. You can't see the vocal cords. Your preceptor adjusts your position and angle. Second attempt, you see the cords and successfully intubate. The rush of relief and accomplishment is incredible. 7:30 to 10 a.m. Maintenance phase. You monitor vital signs, adjust anesthetic depth, titrate medications, document everything. Your preceptor quizzes you constantly. What's causing that blood pressure drop? What would you do if heart rate increased? What's your backup airway plan? 10 a.m. First case done. You're mentally exhausted, but exhilarated. Your preceptor debriefs with you. 10:45, next case starts. You'll do 3 to 4 cases today. By 3:30 when clinical ends, your feet hurt, your brain is fried, and you still have hours of studying ahead for tomorrow's cases. Here's the progression most students experience over their clinical time. Months 1 through 3. You're a novice, observing and assisting, learning basic induction and emergence, placing IVs and airways under direct supervision, managing straightforward, healthy patients. 1 to 2 cases per day. Months 4 through 8. Advanced beginner, more independence with routine cases, learning regional anesthesia techniques, managing patients with mild comorbidities, starting to anticipate problems before they happen. Months 9 through 15. Competent. You're independently managing most cases with distant supervision, beginning specialty rotations, cardiac, pediatrics, OB, handling moderate complexity, 3 to 4 cases per day. Months 16 through 24 plus. Proficient. Independent practice with consultation as needed. High acuity and complex cases. You're even teaching junior students, preparing for the real world. Most programs also require call shifts, those 12 to 24-hour overnight shifts handling emergent surgeries, traumas, and C-sections. Call is exhausting, but some of the best learning happens during those shifts. Let's be honest about what suffers during CRNA school. Social life. Friends without medical backgrounds won't understand why you can't hang out. You'll miss weddings, birthdays, gatherings, hobbies. That thing you love doing, you probably won't have time for it for 2 to 3 years. Exercise. You'll have good intentions, but when choosing between studying and the gym, studying usually wins. Sleep. 5 to 6 hours becomes the norm. Some weeks, even less during heavy exam periods. Relationships, marriages, and partnerships are tested. Your partner needs to be incredibly understanding and supportive. Many students say they essentially missed 2 to 3 years of their kids' lives. But here's what you learn to do. Ruthless prioritization. You can't do everything, so you focus on what's essential. Efficiency. You get really good at studying efficiently, meal prepping, maximizing every minute. Asking for help. You realize you can't do this alone. Strategies that help. Meal prep Sundays so you're not deciding what to eat every day. Study groups. Teaching each other reinforces learning. Scheduled breaks. Even 30 minutes of disconnect prevents burnout. So is it worth it? Here's the honest answer. The lows are real. Feeling incompetent when you can't answer a preceptor's question. Failing an exam despite studying for days. Dealing with difficult preceptors. Missing important family events. Imposter syndrome hitting hard. But the highs? They're incredible. Successfully intubating a difficult airway. Having a complex case go smoothly because you anticipated and managed the problems. Receiving positive feedback from a preceptor you respect. The moment concepts finally click. Realizing you're actually becoming a CRNA. Thousands of people make it through every year. People with families, people who aren't naturally gifted test takers, people who doubted themselves. They survived. And so can you. The keys. Prioritize ruthlessly. Build your support system. Take care of yourself minimally. Ask for help early. And remember why you're doing this. 2 years from now, you'll be a CRNA. The temporary sacrifice will be worth it. If this helped you understand what you're getting into, smash that like button, Subscribe for more CRNA content, and check the description for links to everything I mentioned. Drop a comment below with your questions about CRNA school life. And when you're ready to start your journey, head to crnatracker.com to track your prerequisites, compare programs, and stay organized through the whole process. Thanks for watching, and good luck.